In 1988, alcohol was added to the list of Group 1 carcinogens by the International Agency for Research on Cancer, alongside tobacco, asbestos, radiation, and viral infections such as HIV and HPV. This classification, put simply, means that alcohol causes cancer, yet public awareness of this remains remarkably low. Drinking alcohol is known to cause at least 7 types of cancer: mouth, upper throat, voice box, food pipe, breast, liver, and bowel cancer, and there is increasing evidence that it may be linked to pancreatic cancer. Each year in the UK, alcohol causes as many cancer deaths as deaths from alcohol-related liver disease. But how does alcohol cause cancer? How many cases and deaths does it cause? What are the levels of risk? And what can be done to reduce this harm? There are a number of ways in which alcohol can cause these types of cancer, and all types of alcoholic drinks, whether beer, wine, spirits or cider, can cause cancer, as it is the ethanol in the product that causes it.
There's at least 3 potential mechanisms for how alcohol causes cancer from what we know so far, although there may well be others. The first is we do know that acetaldehyde, that metabolite of ethanol that we metabolize into our systems, damages cells. And what it does is it gets into our DNA, and that means 2 things. First of all, there's cell damage in the first place, but secondly, it can also affect how cells repair themselves. That's the first mechanism. The second one we think is about hormones. So we know that alcohol can change the level of hormones in our body, particularly estrogen and insulin. Hormones send signals around the body, and when those levels are elevated, we know that cells can divide more rapidly. And when those cells divide more rapidly, there's a possibility that an error will be made in that replication, and that is a link to cancer. And then finally, we know in particularly for the cells that line our mouth and our throat, the damage that alcohol does to those makes them more vulnerable. And that means when we absorb different things, whether it's alcohol or maybe if we're smoking, that those cells are more vulnerable to absorb those toxic compounds. And again, there's a link to cancer there.
The more you drink, the higher your risk of cancer, which is why the World Health Organization states that there is no safe level of alcohol consumption. This doesn't mean that you will definitely develop cancer if you drink, but your risk will decrease if you reduce or stop drinking alcohol. And it isn't just people drinking heavily that are at risk. In fact, across Europe, half of all alcohol-related cancer cases are caused by light and moderate alcohol consumption. Yet the number of cases caused by alcohol does vary substantially across each of the 7 cancer types. Breast cancer is the most common cancer in the UK, and alcohol causes a significant number of cases, between 8 to 10%, which is around 4,500 cases every year. 22% of voice box cancers, 34% of mouth cancers, and 38% of upper throat cancers are caused by alcohol, likely between 3 to 5,000 cases each year. And for food pipe, liver, and bowel cancers, 13%, 7%, and 6% are caused by alcohol, respectively. Of course, it's important to consider how risk changes with different levels of drinking.
Another example might be to take, for example, a typical female who is drinking no alcohol. What's her risk of breast cancer? Well, we know that can be around 11%, and not accounting for the range of other risk factors she might have. And then if she drinks above the recommended weekly limit, so say she's drinking 14 to 35 units a week, that risk increases to about 17%. So these numbers may sound small, but actually if they accumulate over time, or somebody's drinking at even higher levels, those numbers go up. So the rise in risk is substantial.
The vast majority of these cancers can be prevented, and they lead to a significant number of deaths. 4% of all cancer deaths are caused by alcohol, amounting to around 7,000 deaths in the UK every year, a very similar number of deaths that are caused by alcohol-related liver disease. And future projections of cancer cases are concerning due to the increase in risky drinking during the COVID-19 pandemic. If drinking patterns do not return to 2019 levels, by 2035 there will be an additional 19,000 cases of alcohol-related cancer diagnosed. For those who smoke and drink alcohol, the risk of developing certain cancers is much higher, as smoking and drinking have a multiplying effect that causes much greater damage to cells when combined compared with when consumed on their own. This may be due to alcohol causing changes to cells in the mouth and throat that make it much easier to absorb the cancer-causing chemicals in tobacco smoke. People who smoke tobacco and drink alcohol have a 5 times increased risk of developing cancers of the mouth, upper throat, voice box and food pipe compared with people who use either alcohol or tobacco alone. Similarly, living with overweight or obesity has also been clearly shown to exacerbate the risk of cancer on its own and in combination with alcohol consumption. One study found that people with larger waistlines who drank above the Chief Medical Officer's low-risk drinking guidelines had a 17% greater risk of developing obesity-related cancer compared to those with a healthy waist measurement. For many years, the alcohol industry has misinformed and spread doubt regarding alcohol's causal role in cancer. A 2017 study looked at how alcohol industry-funded groups discuss alcohol and cancer on their websites. These groups included the International Alliance for Responsible Drinking, Diageo's Drink IQ website, Spirits Europe, the Portman Group, and DrinkAware. It found 3 strategies that these groups used. 1. Denial and omission. Denying, omitting, or disputing the evidence that alcohol consumption increases cancer risk. The Canadian body Edu-Alcool stated that no causal relationship has been shown between moderate drinking and breast cancer. As the researchers stated, this is a factually incorrect statement. 2. Distortion, mentioning cancer but misrepresenting the risk. The Portman Group's response to the consultation on the UK's new drinking guidelines in 2016 stated that alcohol consumption has no impact on the majority of cancers, undermining the fact that alcohol causes a significant number of some of the most common cancers. And 3. Distraction, focusing discussion away from the independent effects of alcohol on common cancers. Many industry groups use this tactic, including Drinkwise in Australia, which states that multiple risk factors are involved in the development of cancers, including genetics and family history of cancer, age, environmental factors and behavioural factors, as well as social determinants of health. But why does the industry not want people to know this causal link?
The alcohol industry is worried about its profits. And if people were more aware of the links between alcohol and cancer, they might see those profits go down because people might reduce their alcohol consumption. We know that the industry is heavily dependent on people who drink above recommended levels, particularly on a regular basis. We think they account for, in one paper, over 60% of alcohol revenues to the industry are from people who drink more than the recommended levels. So I think that kind of evidence is something that's quite scary for alcohol producers, and they'd rather that the public didn't fully understand it.
Currently, people's knowledge of alcohol as a cause of cancer is very low. The most comprehensive English study found that only 13% of people can identify cancer as a potential health outcome of drinking. The North East Alcohol Programme Balance has an annual alcohol and cancer awareness campaign, and now in the North East of England, around 30% know the link. So while progress has been made in some parts of the country, there is still a long way to go on this issue. This begs the question, what can be done to both improve people's knowledge and to reduce alcohol-related cancers?
To improve people's awareness of the links between alcohol and cancer, we need to do a number of things. But the first thing actually is to communicate with the public. So make sure that health professionals are communicating the risks, invest in mass media campaigns that make clear those links, perhaps put warning labels on alcohol products around the link with cancer, as some countries have tried to do or as studies have shown works.
Unlike other food and drink products, alcohol labels are not required to display ingredients or nutritional information. They also aren't required to display the drinking guidelines or health risks. They only need to show the volume of the container, the drink strength and ABV, and presence of common allergens. This means that there is currently more product information required on a bottle of orange juice than on a bottle of vodka. Any other information that is included is done so voluntarily. A 2022 study found that a third of products don't have the Chief Medical Officer's low-risk guidelines, 80% don't have a full list of ingredients, and 60% don't include calorie content. People have the right to know what they are consuming and the health risks of these products, especially the cancer-causing effects of alcohol. Ireland has become the first country in the world to introduce comprehensive labelling, including warning of cancer risk. Beyond that, people should be supported to make healthier choices by shifting our environment so that it isn't so intertwined with alcohol.
To reduce alcohol-related cancers in the UK, we need to take action at the population level. Of course, people need treatment for alcohol dependence and support to cut down their drinking, but to really make a big difference, we need to invest in measures that raise the price of alcohol, for example, minimum unit pricing, deal with alcohol promotion and advertising, so taking action on that, thinking about the availability of alcohol, where it's sold, how accessible it is, and then also thinking about the product itself, making sure, for example, that when we think about alcohol taxation, we have levels that are appropriate to the different amounts of alcohol in products. So lots of different population level policies alongside supporting individuals.
These policies would not only prevent alcohol-related cancers, but also prevent other alcohol-related harms. By preventing harms such as cancer from ever manifesting, we can save lives and ultimately reduce the misery caused by the unnecessary loss of friends and family members.